So there's a real need for us to learn the lessons from the pandemic over the last 18 months. One of the things that happened very early on in the first wave of the pandemic was a big switch was made, and many non-patient facing staff started working from home. What also happened was, if you remember in the first wave of the pandemic, we were asked to stop face-to-face attendances where at all possible, either in primary care, in GP practices, or in hospitals, in outpatients, to try and reduce the incidence for the potential of spread of coronavirus. And what that meant then was that those, if you like, clinical discussions with patients took place virtually, either on the telephone or using some other sort of technology, such as video consultation, or indeed asynchronous technologies, so web forms, asking questions and responding back over a period of hours. Some of those have been beneficial. What we saw, if we look at activity through that period, is there was probably, a 20, 30, 40% reduction in face-to-face activity, maybe a 50% reduction in face-to-face activity in some places. But there was an increase in those other technologies, including the telephone, to cover it. And we now see, certainly in primary care, that demand is higher than it was, significantly, probably 10 or 12% higher than it was originally, if you add up all those various components. That's creating its own problems in terms of the extra demand. But from a technological perspective, we've now got to deliver our services so that they can be delivered in any location, at any time, with the same level of reliability, resilience, safety and security that we'd expect if they were delivered on an institutional site. And that's the real fundamental change. We've got to make sure the option is available. I think clinically then there are a whole set of questions that need to be asked about what's the appropriate setting for an individual to be seen. But the potential for this is enormous going forward, particularly when we add this with the range of technologies that are emerging around being able to monitor people at home. So, check on people's oxygen saturation, ask people to fill in forms at home, and use that as a way of undertaking assessment rather than face-to-face. So I think this is very significant. It will need a lot of support. It requires a lot of transformation, and it may well need people to think differently about how they work, and patients and the public to think differently about how they receive health and care services. And that's quite hard for people because, we've grown up with this through all of our lives and we're sort of used to it, the models of care. So I think that this comes back to then that real question of efficiency and effectiveness at scale, and how you can deliver that to deliver those options of any service at any place at any time.